I'm Yvonne Commodore-Mensah, Associate Professor at Johns Hopkins School of Nursing and Public Health with expertise in hypertension research.
My name is Valy Fontil. I am a practicing primary care physician, health services researcher, and implementation scientist at UCSF.
My name is Dr. Jennifer Cluett. I am a practicing primary care physician and a hypertension specialist in Boston, Massachusetts. I'm an assistant professor of medicine at Harvard Medical School, and I'm the medical director of our multi-specialty hypertension center here at Beth Israel Deaconess Medical Center.
Dr. Cluett, can you talk to us a little more about some of the clinical indications of home blood pressure monitoring?
So it may be intuitive that we ask patients who have hypertension to check their blood pressure at home, but it's useful also in patients who don't yet have a diagnosis. You could also use it treatment response and also whether or not they're taking their medications at home.
So I think you've made a very strong case for why we should implement home blood pressure monitoring. But how do you go about advising a patient? How do you go about advising him to select a home blood pressure device?
So believe it or not, there are close to 4,000 different blood pressure cuffs that are available for consumers to purchase. And less than 20% of those have data to support the accuracy. And so for me, being sort of a blood pressure geek, accuracy is one of the most important factors in determining a whole blood pressure cuff.
Dr. Fontil?
This is a challenge that I think those of us who want to work in this space, who want to make sure that a home blood pressure monitoring program can be effective and sustainable in low resource settings, in sort of safety net clinics or other clinics that are like safety net that have few resources, it's a challenge.
As we mentioned in the disclosures portion, I am on the review committee for the U.S. blood pressure validated device listing. And there we have the rigorous process to review the home blood pressure devices for accuracy. And once they're vetted, they're listed on that website, both for patients and clinicians to use. Sometimes patients will come in because they read in their newspaper or online that a certain blood pressure cuff was recommended. They can have some really important points, but I always ask people to cross-check it with one of these independently validated. In terms of cost, you really can get an accurate blood pressure for as cheap as about $30 or $35. You can spend as little as $30 to $35 or as much as over $100 or beyond. One thing that's really important is to find a blood pressure cuff that fits you. And most adults can use the blood pressure cuffs that come with the packaging. But if you have a larger upper arm size, there are some manufacturers that have accurate cuffs for larger arm sizes. If my patient gets a whole blood pressure cuff, I ask them to bring it into the office once a year to demonstrate proper technique and positioning, and also just to make sure that the cuff fits him and it's still accurate for him. In general, we recommend against some of the fancier devices like wrist devices, just because the accuracy isn't quite there yet.